Hello, I'm Dr. James Bogash, expert in health and longevity and creator of Bogash Life and Balance. And as a practicing chiropractor and a long-term martial artist, this particular topic strikes home. And it is something that I've said again and again and again, that we have a strong overuse of anti-inflammatory drugs, and that I firmly believe that they create more problems than they solve. As a matter of fact, rarely do they actually solve any problems, except for like the drug companies that make them. There's lots of solutions there, but we need inflammation. I consider inflammation as a giant hill that we need to get up and over and down on the other side. However, if we can't clear inflammation, we get stuck on this side of the hill and we keep slipping back down. I have said a common mantra is that chronic pain is the mismanagement of acute pain. So we have an injury, and not even an injury, maybe like I'll go train and everything goes fine, and an hour later I'll be like, what the hell did I do to my fill in the blank, whether it's shoulder or finger or something. And so I'll work on that. But anti-inflammatory drugs create more problems. So as an example, a couple Saturdays ago, I went to class. I usually train on Saturday mornings, so I did kickboxing, did open mat jiu-jitsu and judo afterwards. Everything went fine. That night, in the middle of maybe an hour or so after sleeping, my middle finger started having this sharp shooting pain. Don't know where it came from. After about 10 minutes of hoping it would go away and focusing on it, I finally got out of bed, did some Graston type scraping on there, used my massage gun, soaked it in some hot water, iced it, and went back to bed, and it was fine. Didn't bother me again. Never even occurred to me to take an anti-inflammatory because I know how damaging those can be. In this particular study of 98 patients followed for 3 months with low back pain, they found that those who had increased inflammation, so genes associated in specifically neutrophil activation, they found that those who had increased inflammation were the ones that had the pain resolved. The ones that had persistent pain were the ones that didn't have this increased inflammation. That should be a warning sign for everybody that inflammation is there for a reason. We have seen multiple studies showing that anti-inflammatories, steroids as well, create soft tissue damage. And a lot of times these might not be reversible. So that you injure something, you take anti-inflammatories, and that tissue may never heal correctly. Interestingly enough, one of the techniques I do in the office is something called Graston. It's a specific technique designed to create soft tissue injuries. We want to selectively create selective targeted tissue damage so that it heals the right way this time around. And boils down to like anti-inflammatories. You think Tylenol, you think ibuprofen, you think in the prescriptions indomethacin, the long list of those anti-inflammatories are very likely to create the very problems we are trying to avoid. So for me personally, I haven't taken anything like that in 30 plus years. That's despite elbow dislocations, thumb dislocations, extensor tendons getting ripped off. I've had my share of injuries, and it never even occurred to me to take something like that. And like I said with my finger, if I have an injury, I'm going to treat that right away as fast as possible so that it doesn't progress to injury. And that treatment absolutely does not involve any type of pain or anti-inflammatory. As always, I'll post a link to this particular study in the description. Make sure you like this video, share it with somebody who you think needs the information, and subscribe to the channel.